For accident patients dealing with stubborn neck or back pain, what cutting edge treatments are making the biggest difference for you right now?
Yeah, so this is a good one because this is what the field of pain management has really been about in the last 5 years of the cutting edge technology. So we're seeing a lot of different things coming on, and it's our job as pain physicians to vet these different procedures that are coming up and seeing what is good, what is evidence based, what has the most data to support all these new technologies. And we're seeing things like peripheral nerve stimulators and even more so multifidus stimulation, which are neural nerve implants based into the multifidus muscle that are actually meant to promote strength and kind of regain where we've had some fatty loss or atrophy. We're also seeing something called arterial embolization. So I've been doing this for almost over a year now. And basically, it started off with kind of more of the knee, genicular artery embolizations, but it's a vascular case, and we're actually going into the blood vessels and we're decreasing blood flow and therefore decreasing inflammation, the ability for inflammation to reach certain target joints. And we're seeing a substantial reduction in pain. So this has been going on in Japan for over 10 years and kind of newer to the States. I've been using it mainly for knee and shoulder pain, but now we're starting to see that there's potential benefits in the facet joint, so right along the spine. So arterial embolization is something to keep out for. I think we're just going to see more and more of it. We talked about regenerative medicine, doing stem cells, PRP into herniated discs, into ligaments and tendons, into labral tears. We're seeing substantial improvement with those. And then, as I briefly touched upon earlier, something called dorsal root ganglion stimulation, which is more precise and targeted nerve modulation that goes for specific nerve injuries, right? So if somebody got, amputation of the right arm or crush injury to the right hand, we're able to actually just target the nerves that go into that hand and nowhere else, which makes it a lot more impactful than traditionally having needed to target the entire arm or something. So lots going on in the field as far as cutting edge technology.